talk just a little bit about we'll talk just a little bit about scholarly activity requirements and where you can find them if you don't already know them. And then maybe a little bit about what your next steps would be for projects you might be thinking of. I'm going to have a whole bunch of QR codes. You don't need to scan them all right now with your phone. These slides are available to you in New Innovations, so you can come back and pull up the ones you need and scan them then and access the sites. But this one will get you to the ACGME program requirements for scholarly activity. You probably know this already, but the ACGME has core requirements that are required across specialties by every program. And those are kind of the minimum requirements. And some specialties have added more scholarly activity requirements beyond that. And then your individual program director is empowered to add still more if they feel appropriate. So you probably know better than I do what your specific scholarly activity requirements are for during your residency, but I feel really confident that each of you is going to be required at least to do one QI project and something else. And maybe you're required to do something annually, and maybe you're required to have a publication or a presentation. There might be more requirements than that, but at a minimum, I'm sure you each need to do at least one QI project that you take the lead on. My suggestions with all of your scholarly activity: first, do what you need to do. It's not worth the effort trying to fight it. If you know it's a requirement, do it. Try to plan early. Try to make it meaningful. Try not to just check a box. And in a few minutes, I'm going to explain to you why I think that's really important, that you not treat your scholarly activity stuff like just another requirement in a box to check and then move on. If you have the option, do something that's interesting to you, something that you enjoy doing. You're going to probably put a lot of effort into it, and it makes sense to do something that you enjoy or that means a lot to you rather than something that's pure drudgery. Now, that said, one kind of exception or one caveat to that is if you're doing a QI project, I would at least strongly consider doing something that's important to the clinical organization that you work for, whether it's Value-Wise Health or Dignity Health or both. If they have a particular objective that's really important, an area that they feel like they're not meeting a target quality-wise that you could help with, you might want to at least strongly consider doing something that addresses that deficiency. I'll explain why again in a few minutes. This is an incomplete list of all the scholarly activities you could potentially do. And if your program allows you to do a quality improvement project and some other scholarly activity, you can choose from any of these. I don't recommend that you do the snarky real-time fact-checking of grand rounds. You can do that. And if I go way off base and tell you something that's completely wrong, please let me know, because I don't want to leave inaccurate information with you. But you won't get credit for doing that. Now, if you're doing research, specifically research as a scholarly activity, you will need to do city training. Have you all done that already? I'm getting some nods. If everybody's done it, great. You probably know you have to redo it about every 3 years. Then you have to choose the right IRB. You've got to do city training and a few other requirements that we'll go through in a minute to satisfy the IRB, to show them that you're qualified to do the research in the eyes of the IRB. You have to choose the right IRB, and I'll show you how to do that. Write up a protocol, upload your CV and a conflict of interest statement. And the conflict of interest statements are different depending on which IRB you're going through. And then submit the protocol. And after it's approved, but not until it's approved, you follow the protocol exactly and carry out the research project just like you planned. It's extremely important that you do it exactly as you planned, exactly per the protocol. And we'll discuss some of the differences between that and QI here in a few minutes as well. But you can't go forward with any of that until it's been approved and you have the go letter from whichever IRB is the appropriate one for you. If you have not done city training, this is the link to get to it. And you have to affiliate yourself with every institution that you're going to work with. So if you're going to continue to do research after you graduate from residency, and you go to a different organization to do your fellowship or whatever, you will need to do city training again. If your current training is still current at that point, if it's been less than 3 years, they'll accept some of it, but there will be some modules that are organization specific that they'll require you to do. So what you do is then go in and affiliate yourself with that organization in your city program account, and the modules that you need to do will automatically populate, and the ones that you've already done will be suppressed until they become due again. But you have to affiliate yourself with every organization that you're doing research with, and you can have many affiliations. A lot of people have 4, 5, 6 different affiliations if they're going through different IRBs and conducting research with different organizations. Now, choosing an IRB, this flow sheet is from the Department of Clinical Research and Public Health at Creighton, so it's kind of Creighton focused at the very beginning. If you have any trouble deciding which IRB to use, since we started just a few moments late, rather than go through the entire thing, I'm going to give you the bottom line answer is who owns the data or who controls the people that you're going to be researching. If you're going to be using Dignity Health patient data, go to the Dignity Health IRB. If you're going to be using ValueWise Health patient data, go to the ValueWise Health IRB. If you're going to be using both, heaven help you, because that is a really cumbersome process. But if you're going to be using both, generally you get approved by one and you notify the other and send them documentation of approval from the first one, and they'll accept that approval and let you go forward. Now, if you're doing a study that involves, as the study subjects, Creighton medical students, Creighton residents, Creighton faculty, even if you're just doing a survey, or if you're drawing blood from residents to detect some hormone level that's associated with sleep disruption or whatever, that has to go through the Creighton University IRB, because you're studying people for whom Creighton University has responsibility. So the simple answer, we could go through the whole flow sheet, but the simple answer is who owns the data or who is responsible for the well-being of the people that you'll be studying. And that's whose IRB you need to go to. One possible exception, at the bottom left, at the very bottom of that, number 2, is it a subject matter that may be inconsistent with Creighton University's Jesuit mission? Even if you're using data from St. Joe's or ValueWise Health, if you're doing a study that involves patient data from one of the clinical partners, but the issue is maybe not consistent with, or maybe a little bit in the margins with regard to Creighton University's Jesuit mission, then you really need to get approval from both IRBs, both the clinical partner and Creighton University IRB. I hope that makes sense. If it doesn't make sense, raise your hand, send me an email, yell at me later, put it in your evaluation at the end, whatever. But that's how to choose which IRB to use. Now, unfortunately, each IRB uses a different web application. They collect the same information, but they're formatted very differently, and the user experience is quite different with each of them. I'm going to show you QR codes to get to each of them, but Creighton uses InfoEd, Dignity Health uses iMedrus, ValueWise Health uses Axiom Mentor. Each one also has, within their web application, protocol templates. Now, to make it easier, they can be hard to find digging through the IRB applications. So I've told you that these slides are all available to you in New Innovations. Each of the 3 protocol templates is also available in New Innovations as a Word file. I'm going to show you kind of what they look like a little bit, but go into New Innovations, right next to where this presentation is. I don't know the terminology, in one of the tiles or something in New Innovations. This talk will be there, and those Word files will be there, and use them to start writing up a protocol. So here's a link to the Creighton IRB, to InfoEd, do all the stuff you usually have to do. If you're using the Creighton IRB, you are in luck, because you can just email your protocol to researchacademic@creighton.edu, and somebody there will get back with you, and they'll help walk through the entire process. Easy. They are there to help you. It's people in Omaha, and that IRB is in Omaha, but you can just email the protocol to researchacademic@creighton.edu. Again, you'll have these slides available in New Innovations. You don't need to memorize it or write it down, but the app that you'll go through is called InfoEd. It's not a painful process. It's pretty easy. And this is what InfoEd looks like when you're signing in. Just use your Creighton credentials to sign in to InfoEd. And you should be able to easily make an account there. And this is what the Creighton University protocol template looks like, just the top of it. There's more, it's about 2 pages long, maybe a page and a half. But there are some identifiers at the top that you need to put in to identify yourself and the study that you're proposing, and then study purpose. And there's a description of what you include in your study purpose, and background and significance. And it tells you what to put for background and significance. Now, an important point, and this applies to each of the protocol templates. There's tremendous overlap. They all ask for essentially the same thing, but a little bit different in terms of format. If you do a good job on this, it will save you tremendous work down the road. If you do a good job with writing up your background and significance and your design and methods, when it comes time to make a poster or even write a manuscript, you can essentially cut and paste. You'll need to do a little bit of wordsmithing and change the tense from "we will do this" to "we did that." But you can essentially cut and paste if you did a good job here. So if you're designing the protocol now, when you've got time because you're doing a dermatology rotation or whatever, but when it comes time to write the poster or to write a manuscript, you know you're going to be working in the ICU and you're going to have no time at all. That's okay. If you did a good job on this, you can cut and paste, and it makes it easy. In family medicine, we require the residents to write up protocols for their QI projects as well and submit them to the IRB. I hope the other programs do that as well. Makes it easy for that too. When spring rolls around and you've got to make a poster of your QI project, cut and paste, you're there. Or copy and paste, I guess. So this form is available in New Innovations. If you have a hard time accessing it from New Innovations and you need it, send me an email. I've got it on my laptop. I'll send it to you. Very easy. If you're using the Dignity Health IRB, this will get you to iMedrus. You'll need to make an iMedrus account, do all the same kind of preliminaries. There is not somebody at Dignity Health that will walk it all through for you. It's going to be a little bit more cumbersome. There is also in New Innovations, I think I sent it to you and it got posted, the instructions for how to submit a protocol at Dignity Health. If I didn't, I will. I have an instruction sheet from the Dignity Health IRB that walks you through the process of how to submit to their IRB and how to make sure your protocol gets reviewed appropriately and stuff. Dignity Health is probably the most scary organization in terms of interacting with the IRB. And it's for a really good reason. St. Joe's has a long history because of their association with Barrow and Barrow's academic gravitas in the world. They have a long history of doing funded industry studies, NIH grant funded studies. They've had a lot of them over the years, and they've developed a really robust, very good grant or research management department, research administration department. It's wonderfully suited for those big studies. It's a little bit cumbersome for studies that we're doing at the level of a resident that might just involve data review from CERN or from within Dignity Health. But we do have a document that provides you with the steps that you need to go through to submit a protocol to the Dignity Health IRB as well. That IRB probably takes longer. It's a big, robust, well-designed system, but it moves a little bit more slowly than some of the other systems. So you may want to, if you're going to use Dignity Health data, you may want to submit early and allow a fair amount of time for IRB turnaround. And this is what their protocol template looks like. There's a title page before this, so this is actually kind of page 2. But it's the same information: project summary, general information, that's your identifiers and stuff, rationale and background information, study goals and objectives. There'll be a section for methods. And maybe I'll throw in here that when you're writing a protocol, it's a great idea to involve a statistician early on. I will name the statistician in a few minutes without his permission and give you his email address, but it's really easy. His name's Paul Kang, K-A-N-G. He's been with Creighton here in Phoenix for 9 or 10 months, and he's fantastic. Really smart, knows what he's doing methodologically, knows statistics really well, and he's very easy to work with. So send an email to Paul Kang early on in the process. You don't want to go through all this, collect all your data, get to the point where you're starting to analyze it, and then realize that your data don't answer your question. Paul can help you early in the development process to make sure you're collecting appropriate data to be able to answer your questions. There are other statisticians around and stuff, but feel free to use Paul. He's great. If you're using the Valleywise IRB, this is the code that will get you to Axiom Mentor, same kind of things. You need to establish an account and upload your protocol. There's kind of a questionnaire that you go through. You answer all the questions, you upload the protocol and click submit and go forward. But you do have to also ensure that you've done your city training and that you're affiliated with Valleywise Health in cityprogram.org. You have to do a conflict of interest disclosure and upload your CV. And if you have a license, make sure you upload that as well, a medical license. And then just follow the directions in Axiom Mentor, and it's really not very difficult.
These are...
Yes. Is there a question? No? Okay. And this is what Valleywise Health's protocol template looks like. And that's also available to you in New Innovations. And it's really easy to follow. They tell you what to put in each section. Really simple to do. And if you're doing any of these, you should be working with a faculty mentor who should be able to guide you through all the steps. Now, if you find a faculty mentor who says, yeah, I'm willing to do this, but I don't have much experience with research, so I don't know if I'm much good to you. That's okay. Give them my name or give them the name of Dr. Pooja Dorman over at Dignity Health. One of my roles is research mentor, and I'm happy to work with faculty members as well and help guide them as they learn the ropes and get familiar with how to do this whole process. That's part of my job. So if you have a faculty member like that who wants to be a mentor but doesn't feel really confident, send them to me or send them to Dr. Dorman over at St. Joe's. Now, quality improvement versus research. If you want to do a project and your mentor says to you, hey, you know, I don't want to have to deal with the IRB. Let's just make this a QI project. We'll call it QI and we'll submit it to the IRB and they'll just say it's not research, it's QI, and we can go ahead with it. That's not how you do QI. The research question and the methods, having hearing aids is an awkward thing because they are linked to my phone and my phone starts ringing in my ears. It makes me have vertigo. So quality improvement, you can't just say this is a QI project in the protocol and have the IRB rubber stamp it and say, yeah, this is quality improvement. We don't need to review this. It's about the objective and the methods, and the definition helps with that. Research, according to a federal definition, a formal federal definition, research is a systematic investigation, including development, testing, and evaluation designed to develop or contribute to generalizable knowledge. So you're developing a project from which you want to develop generalizable knowledge. That's a research project. And I've got the human subject part of the definition in my phone. I would have added it to a slide, but I had to submit my slides a while early. The human subject part, there's a federal definition for human subject that makes it human subject research. So the research part applies. And then if you're studying humans, the definition is a living individual about whom an investigator, whether professional or student, conducting research, obtains information or biospecimens through intervention or interaction with the individual and uses, studies, or analyzes the information of biospecimens, or obtains, uses, analyzes, or generates identifiable private information or identifiable biospecimens. So there is a formal definition of human subject research. And if your project, even if you call it a QI project, in the eyes of the IRB meets that definition, then it's research. and it has to go through the research approval process. Now, just my definition, so that I didn't have to write as many words, and I don't think there's a formal federal definition for quality improvement. My definition of a quality improvement project is an internally iterative method of optimizing an outcome for local benefit. So with a research project, remember I told you that you stick with the protocol. You get the protocol approved by the IRB, and it tells you step by step what you're going to do all the way through the project. And when you're all done, you have a data set and you analyze the data according to your data analysis plan that was in the protocol, and then you're done. With a quality improvement project, you're tracking the data as you go. And if you're not seeing an improvement in your outcome, you're changing the intervention and you're analyzing it and watching it as you go. I'll show you an example of that in just a minute, but it's internally iterative, that PDSA cycle that we talked about. And the objective is not obtaining generalizable information. The objective is improving processes locally or improving an outcome locally. How do we improve our central line associated bloodstream infection rate within this organization? How do we optimize our rate of central line associated bloodstream infections? As opposed to, hey, I've developed this new antiseptic, and let's see how well this antiseptic works at improving central line associated bloodstream infections. The latter is research. We're testing this article, this item, this antiseptic, to see if it prevents central line associated bloodstream infections. The former is, yeah, what can we do to optimize our central line associated bloodstream infections? Let's look at everything that goes into that process, everything that might lead to those infections. Let's find the weak point and let's address that weak point. Now, part of the beauty of this, I mentioned earlier, you might want to do this with things that are important to your clinical organization, ValueWise or Dignity Health. But you can also apply it to more personal things. I'm going to pause here. And this is the poster from a project. I don't expect you to be able to read this, but I want you to see the format of it. This is a beautiful poster. This came from some of the family medicine residents a year and a half ago. We have our PGY2s lead the QI projects, and a couple of our PGY2s led this project on improving HPV vaccination rates in people 19 to 26 years of age. And right in the middle of it, I don't know if my laser is working, right in the middle of it is a run chart. That's kind of the money part of this. The run chart is the most important part of your data in quality improvement. And this is how you do a run chart. You have your pre-intervention observations, and you calculate a median from the pre-intervention observations, and you extend it out through the expected duration of the project. And then you do your intervention and you mark it on your graph, on your run chart, and then you continue collecting information and see if you're improving the outcome. I had all of the post-intervention information, post-intervention data populate the graph all at once, but in reality, you're doing it one observation at a time. In this case, 1 month at a time, adding a month at a time. And if you see that you're not improving the outcome, you go back and say, what can we do different in our intervention to get a better outcome? Now, Dr. Asif, are you here?
Yep, I'm here. Thank you.
Okay. Dr. Fadi Asif was one of our residents at the time who was one of the leaders of this project. He now works as an attending for ValueWise Health. He's at a clinic that's kind of far away, and so he wasn't able to be here. But I asked him to take just a couple of minutes and talk about what he learned from doing this really very well done QI project. Go ahead, Dr. Asif.
Hi, thank you. Yeah, so the big takeaways in hindsight, I think that made us successful, or at least able to, generate some meaningful outcomes, was the specific method we used, which required a lot of planning early on. I would say 4 or 5 months prior to when we were supposed to begin the intervention is where it started. So we knew we wanted to do something related to vaccination and potentially women's health. And we came to this idea, but we weren't exactly sure how we were going to what kind of intervention we could do to increase rates. So we met with who's then the clinical the medical director of the FQHC clinics, who is based out of our clinic, Dr. Samarik Snyder. Dr. Erie, who I worked with this on, proposed the idea of potentially modifying the care gaps, which is such that HPV would pop up in those age ranges that we were interested in, and which guidelines had recommended screening for, which was not, present at the time. So it required a lot of meetings with a few meetings with the ambulatory committee, as well as, once we came to a specific intervention after a few of those involving IT, to actually implement whatever software changes needed to be set in order to set it live and get it going. So basically coordinating with those two groups is kind of over the course of 4 or 5 months is, I think, why we were able to get such an intervention that had, really somewhat accurately measurable data to it. And then, of course, there was the once that was in the actually collecting the data, we ran into some challenges with that, because at the time, and I don't know if residents are using this now, there's I think Slicer Dicer is what some of the other more recent projects use. That wasn't available to us at the time, so we had to work with the Epic Reports program and try to sort through all that data and organize it in the way we wanted. And that kind of held its own challenges as well. So basically the takeaway point from all of that is, get started as early as you can. And yeah.
And Dr. Ossoff, can I ask you one question? Do you feel like you learned the methods well enough that you're comfortable with data, you're comfortable with analyzing a run chart and knowing if you've achieved a significant difference, that kind of thing?
Yeah, more so now. Yeah.
Okay.
We tried to involve a statistician at one point, and then that fell through. So we just used whatever software like statistics methods were available to look for significance. But yeah, 5 points, I believe, is what you're looking for above the pre-intervention median.
Okay, thank you. Do any of you have questions for Dr. Ossoff? Okay, thank you, Fadi. I appreciate you taking some of your lunchtime to talk with us about this.
Yeah,
I've
no
got a
problem.
couple of suggestions for your QI projects. First, I suggest that you learn the methods that are in the IHI Open School. I believe the Open School is still free access for students and residents, but you have to identify yourself as a student or a resident. They've established a paywall, but I think you can get through it if you declare yourself to be a resident. If that's not the case, let me know, and we'll put a lot of pressure on administration to try to get access to IHI Open School for all the residents and students and stuff. And then apply them to what interests you or what frustrates you. So again, try to give some priority to the things that are important to the organization that you work for. But after that, if there's nothing that really interests you or nothing that seems like it would be a good project from the organizations you work for, the next thing is, please pardon my language, think about what pisses you off day in and day out and design a project to improve that. Or think about what's really frustrating to the people around you. If you work in a hospital and there's a group of nurses that are always upset about something that's being done in the organization, meet with them and say, hey, let's do a QI project about this. Let's try to improve this. If you're not saving enough money on your own, do a QI project on your own, learn these methods, to figure out how to improve your personal saving rate. You can apply these methods to anything. This is the IHI Open School. The slides are available later. Sign in into the Open School. Learn the methods. They're very simple. If you do this, you'll develop skills that could be handy later. I admit everybody hates QI. When I talk with our family medicine residents about QI, I can just see the pain in their faces because they just can't stand it. They would rather be learning about treatment of hyponatremia in the hospital because everybody loves that, right? But if you learn these methods, it's almost heartbreaking to me to interact with residents and see almost career level burnout happen from time to time at your stage in training. I've had residents say, I don't know if I can do this for a whole career. This is emotionally destroying me. First, if that's happening to you, come talk to me, talk with your program director, talk with your faculty advisor, talk with somebody. And I'm happy to be a person you talk with if you're feeling that level of burnout. But also, QI can be something that if you develop these skills, knowing that everybody you will work with your entire career hates this, if it's something that you develop some skill in, when you finished residency, you're working, you're practicing, you're in an organization, and you start applying these methods and start improving things, you might have opportunities to carve out some protected time to do this. If you still hate it, then gosh, your life just got a lot worse. But if it's something that you might enjoy doing as a break from seeing patients all day, every day, it's an option. So the skills might come in handy later. So sign up for the IHI Open School. Dr. Asif brought up trying to reach a statistician. The IHI methods will show you how you can do this kind of analysis and know what's a significant difference without doing any stats, without calculating a p-value. That said, remember the median line there is a median, not a mean, but it's really easy just in Excel to calculate to do a t-test and calculate a p-value for a difference in the mean before and after the intervention. And if ever you have questions about that, reach out to me. I'll walk you through it. It's super simple. You don't have to buy a statistical application. It'll take you 20 seconds and you can calculate a p-value for a t-test. If you want that as a backup, you're going to show your data in a run chart on the poster that you present, and you want to add a p-value to it, just let me know. I'll show you how to calculate a p-value from a t-test for before and after. Very easy. Also, if you do a QI project, it wasn't approved by the IRB as research. They said it's quality improvement. It's not human subject research. So they told you they don't have to provide any more oversight of it. You can just run with it. Does that mean you can't publish it? No, of course. The thing that makes a difference is not your intent to publish. Remember, it's the objective. Is my objective to create generalizable evidence or information, or is it to improve here and now? If you do it with the objective of improving here and now with an iterative process using QI methods, and you find that you've done something earth-shattering, share it with the rest of the world. There is nothing wrong with that at all. You can still publish QI projects. If you want to do a case report, I've had so many people come to me over the years and say, I don't have any idea what to do. I want to do a case report. I've got a case, but I don't know what to do. First thing, talk with your clinical mentor. Make sure it's a reportable case. Then follow this QR code to the CARE guidelines. CARE stands for case report. And it's really easy. There's even a CARE writer. It's not AI. It won't write it for you, but it'll take you step by step through what to enter in different sections, and it'll organize it for you and put it in a nice format that's easy to submit for publication. So if you want to do a case report, have a clinical mentor who can help you determine if it's a reportable case, and then go to this site and it'll walk you through the process. Data review studies, if you're going to use clinical data, You would be doing a cross-sectional, longitudinal cohort, a case control study. Make sure you work with a mentor. You'll have to write up a protocol that says exactly what you're going to do. You submit it to the IRB like I've talked about and stuff. But the mentor will have to be the PI for that. In general, residents can't be PIs. In a lot of cases, fellows can, but residents can't be the principal investigator, who's kind of the one really responsible for the project. So you'll be working with a mentor. Encourage your mentor to involve a statistician early. And there's Paul Kang's email address. Call Paul. He will help you early in the process. He'll help you design the study. He'll help you with what data to collect. He'll help you with the statistical analysis plan. And then he'll actually run the data for you and generally will send you back your results. And also he will have written your methods section for the paper. He'll make it really easy for you. And then the strengthening the reporting of observational studies in epidemiology, or STROBE statement. This won't help you with designing a study, but it'll help you with writing up your study. If you're doing one of those, if it's not a clinical trial, if it's a longitudinal study, case control, or cross-sectional study, following these guidelines will help make sure that you write a clear, well-organized paper that's maybe more likely to be accepted for publication. This is kind of an industry standard for writing that type of paper and presenting that type of data. Clinical trials, you're probably not going to be very involved in clinical trials. If you are, it will be with a faculty member who is the principal investigator for the trial. The main thing I want to suggest to you about clinical trials is if you approach a faculty mentor who has a clinical trial going on and you say, hey, I want to help, I want to get involved in research. And if you're thinking, I want to do this because I'm applying to a fellowship and I need this to put on my fellowship application, have that discussion with the mentor early on, because what you really need is a presentation or a publication. And if you're just there helping to collect data for a 10-year clinical trial, you're not going to get that. Let them know I need authorship on a presentation or publication, and they'll help you design a project that could be using data from the clinical trial or could be something entirely different. But if you are assisting with a long-term clinical trial that's large and multi-center and funded, you're not going to get authorship for anything, realistically. So have that discussion with the mentor early on. Authorship needs to be earned. There are criteria for it. I didn't make a slide about that, but a quick Google search will show you what the criteria are to actually earn authorship on a presentation or publication. Dr. Gridley recommended that I include a slide about predatory journals. Creighton University Libraries has a great site that can help you determine if the journal you're trying to submit to is predatory. So there's a lot of medical scientific publishing, and it's growing ridiculously. And so unscrupulous people have come into the market and said, hey, we're going to provide an opportunity for publishing for all of these people who want to publish stuff, because there's way more people that want to publish than there are venues for publishing. And they charge exorbitant rates. They provide limited, if any, peer review, but also you might shell out all the money, which could be thousands of dollars, to pay for the peer review up front, and you never get published anywhere. And if you do get published, it might be in a journal that's not even referenced. So it doesn't really count. Creighton University Libraries site can help you determine if the journal you're submitting to is predatory or not. And there's another site called Think, Check, Submit. And this is a link to that site that also could help you to determine if you're with a reputable journal or not. And so finally, you've done all the preliminaries and you're ready to start writing up your protocol. Every project, every scholarly project starts with a question. If you're doing a grand rounds, it starts with a clinical question that you try to answer by appeal to the literature and pulling together the greatest scientific literature that's currently available to answer the clinical question. If you find that there is not sufficient data there to answer the question, Then you design a study and try to answer the question yourself through a research project or a quality improvement project or whatever is appropriate. But it's what is appropriate is determined by the research question. So the first question here, what can we do to improve blood pressure control in our hypertensive patients? What type of project will answer that? It's a QI project. That's QI. Is this case novel? How can I describe it so people know this type of case is possible, this happens to people? Obviously, that's a case report. Number 3 is a legitimate question that you guys could answer with a clinical trial if you chose to. Do scheduled basal bolus correction insulin regimens result in more time in glycemic target range than sliding scale insulin in non-ICU hospitalized adult patients with type 2 diabetes? That's a clinical trial. Now, if you don't have the resources or time for a clinical trial, you might be able to approximate an answer to that one by doing a case control study or a cohort study, but a clinical trial would be best. But whatever you want to do, it starts with the research question. You ask the question, and then you design a study to try to answer that question. And if you've got a faculty mentor who can help you with that process, wonderful. If you don't, please come to me, or please go to Dr. Dorman over at St. Joe's. We are happy to help you either connect with a mentor or coach you or coach your mentor and help to develop a protocol and get it approved and help you conduct the study. We want to help you succeed with this. So I think that's all I've got to say. I'm going to skip through the question slide and get to the important one for you guys. On the left is the sign in, and on the right is the feedback. Sign in, that's for you guys. You need to do that. Feedback is for me. So please be brutally honest and let me know the parts of this that were the most intolerably horrible. And I'll try to repeat it in case they ever ask me to do it again, which they probably won't. Now, any questions about any of this? And nobody asked the question about my bio. I guess nobody read it.
No questions, anyone?
No questions? And please, I am serious. Reach out to me if I can be of any help to you at all with any of your scholarly projects, no matter what they are. I don't claim expertise in everything, but I can help you find the resources that will allow you to be successful. Your success is our success. So we want to help you be successful. If there are no questions, I apologize for letting you go 10 minutes early. Thank you all. Did you all get this? So I can move to that. Anybody still need the QR codes? Okay. Okay.